Medical mismanagement might be one of the most overlooked LGBTQ topics and the one most likely to cause them death or injury. Discrimination in healthcare is so common that nearly 1 in 5 LGBTQ adults have avoided medical care due to the fear of discrimination. Even in medical schools, LGBTQ health-related issues are rarely taught, and when they are generally special elective courses. So what can you do to protect your rights in the hospital? Hi, I'm attorney Doug Mann, and I'm a managing partner with Dyer, Garofalo, Mann & Schultz. Our law firm practices in Indiana, Kentucky, and Ohio. We support PFLAG, the Dayton Pride Parade, and work hard to promote inclusivity in our firm. As a lawyer and as a father of a gay son, I believe that we could be doing so much better for our community in Ohio. Those living with HIV or transitioning are facing some of the largest barriers in their access to health care. They can be vulnerable to breaches of confidentiality and violations of their personal autonomy when trying to make choices about their health and well-being. On January 18, 2018, an announcement was made by the Department of Health and Human Services, the creation of a new department that expanded religious freedom to the medical field, the Conscience and Religious Freedom Division. This new division made it possible for healthcare facilities and workers to deny care based on their religious beliefs and will almost certainly cause life-threatening harm to both women and the LGBT community. This means that it can be even harder to find a hospital that will want to work with you. But you don't have to become one of the 1 in 5 that avoid hospitals. You have the resources and you still have people fighting back against those injustices. So how do you find a hospital you can trust? The HRC or Human Rights Campaign may be a good option if you need to keep your medical care in-network. With a searchable database and map, you can see the hospital's policies and get a feel for the level of care you may receive. For hospitals that are members of the HRC, you can see how well they scored on everything from how they treat LGBTQ patients to how they treat their staff, scored on a 1 to 10, 10 being the best. Even for non-members, you can learn 3 valuable things about the healthcare facility. Do they have a patient non-discrimination policy? Do they have an equal visitation policy? Do they have an LGBTQ inclusive employment non-discrimination policy? Equitas Health, formerly the AIDS Research Center of Ohio, provides comprehensive health care for the LGBTQ community and beyond. It is one of the nation's largest LGBTQ healthcare organizations that has 21 locations across Ohio, Kentucky, and West Virginia. They function as a pharmacy, medical and mental care, as well as many other services. The City of Columbus has also made some great strides with the LGBTQ Health Initiative. This sets criteria for medical facilities in the Columbus area to be LGBTQ friendly. Although an application only requires that a provider be able to say yes to a set of questions, the community is able to reach out to the initiative to say if they receive quality care in that location. In Northern Ohio, health services such as Metro Health and the Cleveland Clinic are also inclusive and helpful in providing transition-related care. If you face discrimination with your healthcare provider, you have many options on speaking out. 80% of the nation's hospitals are accredited through the Joint Commission. The Joint Commission prohibits discrimination based on sexual orientation and gender identity and will review all quality of care violations. You can make an online complaint with the Human Rights Campaign. That may lower the score that hospital has in their database. Reaching out to the hospital's complaint department is also a good step forward. Unfortunately, this past year has seen a lot of slidebacks in LGBTQ rights in the healthcare industry. You still have legal options though. If you've experienced medical malpractice, breaches of confidentiality, or your visitation rights denied, you have the right to speak out. Medical malpractice is illegal no matter the sexual orientation or gender identity of the victim. Your first step is contacting the medical professional involved. Try to get an understanding of what went wrong and if it can be fixed. Many doctors will seek to avoid a medical malpractice case and may sometimes fix the issue free of charge. If this doesn't have a positive result, your next move is contacting the Medical Licensing Board. They can issue warnings or discipline the medical professional. You then have 1 year to file a medical malpractice suit against the doctor. Any images, proof of wrongdoing, or confession of the doctor's negligence can help your case. Many lawyers are able to track down your medical records and hire the right experts to help your case. If your HIPAA rights have been violated, you can file a report to the HHS or talk to a lawyer about your next steps. Unfortunately, Ohio is a mandatory reporting in health facilities if you're HIV positive, and you may not have any legal recourse if your private medical records are released without your permission. Visitation is still an issue that many people run into when they see their partner in the hospital. It may be uncomfortable, but creating legal documents that tell hospital staff who you do and do not want to visit you in the hospital, or creating a living will may cut down on the negative interactions in healthcare facilities. One important document you can create is naming a healthcare proxy, a guardian, a conservator. This person is who you name to be in charge of your health decisions should you become incapable of making them for yourself. To keep important legal documents on you in case of emergency, Lambda Legal suggests creating a packet of legal documents in a passport holder. Having a copy of your certificate of marriage, living will, and named healthcare proxy on yourself or on your partner can easily prove the wishes of the incapacitated individual. One right that you always have, if you require it, is legal counsel. Finding a lawyer that is working in your best interest is extremely important when you begin this process. Most lawyers offer a free consultation so you can sit down with them in the firm and really figure out if that lawyer works for you. Some questions to keep in mind when meeting with a potential lawyer: does the firm have the experience with medical malpractice involving HIV status or gender identity? Does the attorney have doubts about the rights of LGBTQ people? Firms like Dyer, Groffel, Schultz that protect the rights of LGBTQ people exist across the state, and many work with Equality Ohio's legal network. If you're in need of help with your medical malpractice case, you can reach out to my firm or Equality Ohio and get the resources and legal help you need.